Did you know your body is constantly logging the status of your heart and blood vessels, literally right at your fingertips? Seriously. Most of us, we think of our nails purely in terms of grooming. But the crazy truth is, they act as this hidden window into your cardiovascular health. They're silently revealing secrets that the rest of your body might be trying to hide from you. Today, we're going to learn exactly how to read those secrets.
In fact, let's just do a quick test right now. Look at your hands. I want you to press down on one of your nails firmly for about 2 seconds until it turns white. Okay, now let go. And watch really carefully how long it takes for that pink color to return. What you just did right there is a rapid capillary refill test. It's the exact same screening cardiologists use to assess your circulation in seconds, without any fancy machines. We're gonna decode exactly what your result means in just a moment. But before we begin, subscribe to @DrHealthExplained for evidence-based health insights.
All right, let's dive into this explainer. Here's our roadmap for today. First, the 2-second test. Then, sign 1, discoloration. Sign 2, brittle nails. Sign 3, slow return. And finally, sign 4, the missing lunula. Trust me, you are absolutely going to want to stick around for that 4th sign. It takes like 3 seconds to check, but the results leave people totally shocked.
So why are we even focusing on this? Well, the crucial thing to understand is that these signs become incredibly important after the age of 50 or 60. See, when you're in your 30s, your heart and blood vessels have this massive reserve of power. Your body can easily hide early cardiovascular problems. But after 6 decades of non-stop work, that reserve drops. Heart issues start to develop silently, kind of sneaking up on you without obvious symptoms like severe chest pain or fainting. And at this stage, your nails turn into one of your only early warning systems.
To understand why this happens, we just need a quick look at the biology. Your nails actually grow from something called the nail matrix. Think of it as a layer of living cells right under the root of your nail, and it's in constant direct contact with your bloodstream. The capillaries feeding this area are literally among the tiniest blood vessels in your entire body, and because they're so microscopic, they're extremely sensitive. The very second your cardiovascular system experiences a drop in oxygen or poor circulation, these tiny vessels are the very first to show signs of distress.
All right, moving on to sign 1, nail discoloration, and decoding a condition called cyanosis.
When you see a blue or purple tint appearing on the nail bed, that's what we call cyanosis. But there is a massive difference in how this actually presents itself. First up, we have peripheral cyanosis. This is when that blue or purple tint is strictly on the nails or toes, while your lips and the inside of your mouth stay a nice, healthy pink. This usually builds up really slowly, over weeks or even months. Basically, it's a warning that your peripheral circulation is slowing down. But on the flip side, we have central cyanosis. This is when your nails and your lips or tongue turn blue. Listen, this is a medical emergency. It means the blood leaving your heart just doesn't have enough oxygen, which points to an immediate heart or lung failure.
To show you just how easily peripheral cyanosis gets dismissed, check out this case study from our sources. There was this retired postman who noticed a slight purple tint at the base of his nails, especially in the mornings. And you know what? He completely ignored it for a year. He just figured it was from the cold or, simply getting older. It wasn't until his daughter noticed and actually pushed him to see a doctor that he got tested. The result? He was in the early stages of heart failure. But because it was caught early, simple medication and lifestyle changes completely prevented a serious hospitalization. So if your nails stay blue even when your hands are warm, please tell your doctor. Okay, sign 2, brittle and slow-growing nails. It's incredibly common for folks over 60 to look at peeling or weak nails and just say, well, I'm getting older, it's inevitable. But guys, that is a dangerous myth. If your nails suddenly start breaking easily or their growth slows to an absolute crawl, your body might literally be flashing a warning light about your circulation.
A lot of times, brittle nails are actually a leading indicator of peripheral artery disease or PAD. This is a narrowing of the blood vessels delivering blood to your hands and feet caused by a buildup of fatty plaque. And here is the truly terrifying truth about PAD. The exact same plaque that's clogging the vessels in your fingers is highly likely to be forming in the vessels of your heart and your brain. It's a massive red flag for a future heart attack or stroke.
Your body actually connects these symptoms through what we call the PAD warning triad. It rarely just presents as one single symptom. So if you have brittle, weak nails, combined with hands and feet that are constantly cold, and you experience pain or a feeling of heaviness in your legs when you're walking uphill, like a pain that magically goes away when you rest, you really need to speak with a physician.
Take this one story, for instance. There was a woman who absolutely loved gardening, and for years she just assumed her brittle, peeling nails were a direct consequence of digging in the soil. Makes sense, right? But when she started feeling that characteristic heavy feeling in her legs while walking up inclines, her doctor finally connected the dots. She was diagnosed with PAD. Because they caught it through that specific triad of symptoms, she was able to make lifestyle changes that drastically reduced her stroke risk.
Moving right along to sign 3, slow blood return. Now it's time to decode your results. Remember that capillary refill test we did right at the beginning? We're finally going to talk about what it means. But really quick, if you're finding this helpful, please like and share this video so we can reach more people with this crucial information.
Okay, let's break down the numbers. When you pressed your nail and let go, you were basically timing your blood flow. If that healthy pink color rushed back in under 2 seconds, your microcirculation is generally doing great. You're good. But the absolutely crucial number to remember here is 3. If it takes 3 seconds or more for the color to return, especially if you're testing this across a few different fingers, it's a huge indicator of severe microcirculation issues. Medical studies actually link this delayed return to reduced heart function, atrial fibrillation, and even an increased risk of stroke. You can actually pair that visual test we just did with a quick physical one. Try this right now. Touch the back of your hand to your face. If your hands are consistently, noticeably colder than your face, even when you're just sitting in a nice warm room, it's a really strong secondary confirmation of poor circulation, and it definitely shouldn't be ignored.
I mean, the stakes for this simple little test are incredibly high. Take the case of a man who decided to try this exact test one evening. He pressed his nail, let go, and counted. It took a full 5 seconds for that pink color to come back. He was obviously alarmed, so he called his doctor the very next morning. Well, tests revealed he was actually suffering from a dangerous cardiac arrhythmia that put him at incredibly high risk for a stroke. That one simple, 5-second observation literally led to life-saving timely treatment. So if your test takes more than 3 seconds, write it down and tell your doctor.
All right, here we are at sign 4, the missing lunula. This is the one almost nobody talks about. I want you to look really closely at the base of your nails, right near the root. Do you see a small, white half-moon or crescent shape? That right there is the lunula. It's actually the visible portion of the nail matrix we were talking about earlier. You know, the place where new nail cells are born. In a totally healthy person, this white crescent is usually super prominent, especially on the thumbs and index fingers. Now, changes to the lunula act as direct, flashing warning lights from your body. If these white crescents suddenly disappear, shrink, or change color entirely, you need to pay attention. For example, a red crescent can actually be linked to heart failure. A blue crescent? That points straight to severe oxygen deprivation. And if the lunula becomes incredibly pale or just vanishes completely, it is a glaring warning sign of severe anemia or early heart strain. And look, this isn't just theory. A 72-year-old woman recently noticed her white crescents had almost completely disappeared. Her daughter, who thankfully happened to be a vigilant nurse, insisted she go see a doctor, rather than just chalking it up to getting old. Thank goodness she did, because blood work and tests revealed severe anemia that was placing a massive, really dangerous strain on her heart. Just catching that missing lunula allowed them to intervene way before the heart strain caused any irreversible damage. So the crucial takeaway here is action. What should you actually do with all this information today? Well, first, I want you to go to a window and check your nails in good natural light. Do that 2-second refill test across a few fingers. Closely inspect your lunulas for any color changes or shrinking. And I highly recommend this. Take a clear, well-lit photo of your nails right now. It gives you a baseline so you can track any subtle changes in the future. Just remember, a single sign isn't a reason to completely panic, but if you're noticing multiple signs from this explainer, your body is definitely demanding a doctor's attention.
You know, your body has been communicating with you for years. Sometimes it shouts with really obvious pain, but a lot of the time, it just whispers through quiet, subtle signs, like the ones right on your fingertips. The difference between those who suffer sudden health crises and those who thrive, it's simply knowing how to read these signs before it's too late. So really take a look at your hands today. Subscribe to @DrHealthExplained and turn on notifications for more science-backed health content. See you in the next explainer.